Tents have been erected to deal with the overflow. Inside, the sick lay in wait, worried parents watching on. The Philippines has been gripped by a measles outbreak. Erlin Rubio's 2-month-old baby caught the highly infectious virus before he was old enough to be vaccinated.
Sobra na yung rashes niya.
My baby had a lot of rashes. I thought it was because he was taking antibiotics for his cough and colds, but it turned out to be measles. It's already painful to see your baby sick. What more when you hear that many have died from the disease? You don't want that to happen to your baby.
There have been more than 8,000 cases of measles in the Philippines since the start of the year. More than 100 people have died, mostly very young children who are unvaccinated. The health department has declared a measles outbreak and says that it is now struggling to contain it.
There's really a need to do catch-up activities because the challenge is to attain herd immunity. Herd immunity means that you have enough people who are vaccinated so that those who are not vaccinated are unable to transmit their measles virus and infect others.
Immunization rates in the Philippines have been dropping in the last few years. A recent scare involving a dengue vaccine caused immunization rates to plummet even further.
These are a myriad of reasons why we have a low vaccine coverage. In 2018, it even went down to 40%.
Efforts to tip the scales haven't been fast enough. Charmaine Abad thought she'd been immunized, but picked up the virus while at a health center for a prenatal checkup. Measles can be extremely dangerous for pregnant women.
I'm scared about what will happen to my baby, but I'm trying to be strong. My doctor said the condition shouldn't affect the baby because I'm at 32 weeks already. But I'm scared.
Local authorities are working with the Red Cross to increase hospital beds for those affected and immunize as many people as possible to try and contain the outbreak. Mothers like Angela Asherto are not taking any more chances.
The news about kids dying from the dengue fever vaccination scared me, so I was scared to have my children vaccinated. But now I know it's for their own safety.
Immunization rates are steadily rising again. Health authorities hope that the continued confidence in vaccines will help stem this measles outbreak.
Joining me to talk more about this is Richard Gordon, chairman of the Philippine Red Cross in Manila. Richard, give us some context. How bad is this outbreak?
Well, the outbreak has spread very fast now. It's in several regions of the country, particularly the two regions immediately close to Metro Manila, which are heavily populated. And now we have about almost 15,000 people, 14,000 cases affected by measles, and about 238 people dead. When you consider the fact that last year there were 202 dead, and we've just finished February, which is only 2 months, we were already overshot the death rate last year.
The numbers keep going higher and higher. Now, our correspondent in the report talks about the dengue fever vaccine and fears over that. Is that one reason that's driving a lot of parents from vaccinating their children in general in the Philippines?
Yes, that's one major reason. Sanofi pushed the product upon the Philippines, put out a lot of vials, and then it turned out that there were some questions about the drug, and a lot of people died afterwards. There's some form of hysteria that followed, understandably, but of course there's no decision yet on whether, in fact, they were killed by Sanofi. But nonetheless, a lot of people were turned off by that.
Now, what does the Filipino government need to do to reverse this trend, to convince people to get their children vaccinated and to solve the current problem?
Well, DOH, Department of Health, is doing a good job. We're helping them. We're telling them that these measles shots are shots that have been administered for the last so many years. It's part of the expanded immunization plan. Unlike the dengue vaccine, which is a forced experiment upon us. So a lot of people are now concerned because they see a lot of people that have died, and they're now going back and coming in. In part of the Red Cross, we have full court press, house to house inoculations are going on, as well as the Department of Health and the local government, which is really the front line, initiator of vaccination. Well, when we devolve powers from the national government to the local government, it's slow on the uptake, so we have to rush for that.
Okay. Well, Richard Gordon, thank you very much.